our third year. This is our third year of running this series, and to kick off the presentation or the webinar for 2022, we have with us Colonel Dr. Wan Azmil bin Wan Mohamed Annuar, consultant in restorative dentistry from Hospital Angkatan Tentera Tunku Mizan, to speak to us on the dental age estimation. Now, you must be wondering as to why we have a restorative specialist talking to us on a forensic topic. I will leave that to Colonel Dr. Wan Azmil, because apparently he told me he will self-introduce himself from his slide. So without further ado, please welcome Colonel Dr. Wan Azmil with your lecture on dental age estimation. Thank you.
Okay, thank you very much, Madam President. Okay, actually, thank you very much for the MAPD for inviting me in giving the webinar to attend this to present in this MAPD webinar series. I think this is the first webinar for this year, if I'm not mistaken. So first of all, let me introduce myself. Even though like Dr. Joanna said that I'm actually by profession, my specialty is restorative dentistry. Okay. Actually, I'm graduated back in 1995 from University of Malaya. And then first posting is in Pegat Pusat Pergigian Angkatan Tentera Sungai Petani as a dental officer for 5 years. And then I got the opportunity to further my study in restorative dentistry, in conservative dentistry in University of Malaya. And then from 2004 until 2007, I've been posted after graduated from Then I've been posted to Naval Hospital in Lumut until 2007. And then in 2007 until 2013, we've been posted to Sarawak. And then at that time, I was assigned as a principal dental officer in the 1st Division Infantry in Sarawak. And then in 2013, we came back from Sarawak, and then I've been posted to Malaysian Armed Forces headquarters as we call a technical and material, kernel technical material, which is involved in terms of purchasing the procurement of the equipment and also the dental material. And then in 2016 until 2017, I got another opportunity to do my area of interest, which was sponsored by Malaysian Armed Forces, in doing Masters in Forensic Odontology in Catholic University in Leuven, Belgium. And then I'm currently actually is a restorative specialist in the Armed Forces Hospital in Tunku Mizan in Wang Semaju. Okay, my involvement in forensic is not that long. Actually, I'm started involved with this forensic operation start in 2014, which is I directly involved in MH17 air accident in Ukraine, whereby we as a DVI Malaysia involved in the DVI operation, which is identified the victim in Netherlands. And then in 2014 also, end of 2014, 2015, I also involved with the DVI operation whereby AirAsia QZ8501 civilian accident in Surabaya. And then from that year until 2018, I involved quite a number of all the operation which involve the identification of the human remains, including Wawasan in Wang Klian, and we have an forensic archaeology operation in Opganga, in Bubu, in Perak, Gunung Bubu in Bruas. And then the last operation, which is involved with the New Zealand Armed Forces, is a process of repatriation of the skeletal remain of the fallen New Zealand soldiers, which buried in the Commonwealth War Grave in Terendak, Melaka, and also in Cheras, and also in Taiping. This is the few picture that operation that I involved, including the exercise in Timataso. Okay. Currently, I'm working in Hospital Angkatan Tentera Tunku Mizan in Kuala Lumpur in Wang Semalawati. This is our building. Actually, our clinic actually in the first floor. And then we have, I think we have about 10 surgeries, and there are multiple specialty in our clinic, headed by our head department, Dr. Zulkifli, is a public health specialist. We have endodontist, periodontist, and also orthodontics in our facilities. And then we have quite a well-equipped like a microscope, and inshallah this year we will getting our new digital lab in Hospital Tunku Mizan. And we receive all the patient from the military, from the soldiers, from their dependent and civilians is working with the Malaysian Armed Forces. Fortunately, these few years we getting patient from the VIPs, and then last 2 years now we are treating Yang di-Pertuan Agong and also Permaisuri Agong in our facilities. This is actually a picture of the Madam President with the Permaisuri Agong when I was called to do the treatment during the weekend. Okay. So, okay, this afternoon, I'm going to talk about the dental age estimation. Actually, in Leuven, actually I learned a lot in terms of the method of age estimation. Even I have to do a research on dental estimation. In my study, I did a dental estimation using the DNA sample, which we have a few markers in the dental pulp, dentin, and also cementum. And then we have a marker whereby we use that marker as the variable to come up with the model with the model which we can predict the age. But actually my research is just the initial part of the using of DNA in age estimation. Okay, for this afternoon, I think I will talk more on dental age estimation in children. Okay, so for the introduction, what is the definition of the dental age estimation method? Actually, this dental age estimation method is a method predicting an individual in terms of the chronological age based on the changes of an age related to the dental features. So what are the dental features that we look into? Actually, we can look into the tooth development. You can see in this radiograph there is still tooth germ is underdeveloped. And then in children, in sub-adult, and then in teenage, we can see that even though that the permanent teeth are already fully developed, we still have the what we call that the eight the wisdom tooth that's still in the development process. Then we can use this variable or this development tooth development to as a variable to do the age estimation. And then other than that, even in the adult, we can use few variables and then few methods that we can do the age estimation in adult. Especially we can see during the aging, there will be an attrition, formation of the secondary dentin, And also we can see that there is a changes in terms of root. There will be a translucency in the root at the root apex. And we also can use the retraction of the periodontal ligament as a tool to do the age estimation. So what is the importance of the age estimation? Actually, the age estimation is important because one, sometimes in the forensic work, they are used to assist in profiling the living individual or deceased. Let's say if you got the skeletonized human remains, sometimes we have to determine whether the skeletal remains belong to the children or sub-adult or an adult. From the anthropology perspective, actually we can do some sort like age estimation and sex determination using the anthropology method. But I think for the age estimation, and the usage of the dental age estimation is more reliable. Other than that, it also in terms of the helping in terms of narrowing the unidentified human remain, or when they are when they found a body or unrecognized human remain, sometimes we have to do the age estimation to narrowing down which group they are belong to. And then age estimation also been used in connection with the crime and accident. And lastly, it's also important for the society in terms of the school attendance, social benefit, employment, and also a marriage, because some of the country, they have a certain limit, certain age that they can got marriage and all that. So sometimes to determine the age, we can use the dental age estimation to determine what age group they are belong to. Actually, this is just a general procedure how actually the dental age estimation has been developed. Okay. Normally, how the dental age estimation developed is by us looking into dental variables, and then we collect a data, and then we process the data, and sometimes we have to come out with a method such as a mathematic module, so we can use that module or that model in terms of to get estimate the age for the individual. So for the method of age estimation, there are few actually age estimation method that are in the literature. Sometimes it depends on the expert, or it depends on the individual which method that you want to use. Okay. So in this lecture, in this presentation, I will go into the method that we usually use for the age estimation, especially for the children. Okay. Like I said, there are a few types of age estimation that method that have been developed. For instance, this is an Angkatan, is an atlas, is quite a user-friendly method whereby you can compare the eruption and the development of the tooth germ, and then you can you can estimate the age group of the individual. All right. And then this is one of the, I think, a classic table that even until now they are still using this. This is part of the method whereby you can use this table just to compare which are the age group for the individual. All right. And then they have a very complex mathematical models, which is they use statistical models whereby you can use this model to determine or to do the age estimation. In this mathematical module, this is a method whereby we determine the age estimation for the sub-adult, which is between 16 to 20 years old. Okay, and then they also have a mathematical model in predicting or in the age estimation for the adult. This is the classical age estimation. Even until now, we are still using this model, this formula, to determine or to estimate the age of the individual for an adult. This method actually has been developed since 1950 by Gustafsson. And then there are a few other methods, mathematical models we can use in adult, okay, like Johansson, 1971. And then we also have the radiographic method, whereby we can use an X-ray, and then we can measure the size of the pulp. And then they have a models whereby we can just fit in all the variables and all the values, and it will come out the estimate age for the individual. They can be used for a single tooth and a multiple tooth. And then in terms of the classification of dental age estimation, we can classify the age estimation by using the developmental or morphological or biochemical, and then is either destructive or non-destructive. Destructive or non-destructive, the difference is that destructive is that we have to take out the tooth, and then we have to destruct. That means we have to slice the tooth and then see the translucency, the size, the secondary dentin formation, and the attrition. For non-destructive method is the method whereby we use a radiographic image to study the size of the pulp in order to get the age estimation. They also come out with other method, non-destructive method, by using a 2D or panoramic and also a 3D and CBCT images to do the age estimation. Other classification of the dental age estimation method, we can divide into the age group, which we divide into 3. Which is children, which is 60 years, under 60 years old, and sub-adult, which is from the range of 16 years old to 23 years old, and above 23 years old is an adult. We can see in this picture, in this diagram, that we can see there are 3 groups. We can see in 16 years old group, there are few variables that we can use in terms of do the age estimation. Is more towards the development of the deciduous and the permanent. And for the sub-adult, we can still use the development method, whereby there are still development of the 3rd molar still exists. And for the adult, all the tooth has already matured. The only method the only variable that we can go into it is with the morphology method and also a biochemistry method. So these are the variable and the method that we can use in children, sub-adult, and also in adult. So you can see that for the children, we go into the tooth eruption and also the tooth development. And for the sub-adult, normally we look into the 3rd molar development by using a few methods, which they have some sort of a formula or a statistical model that we can do the staging, and we can estimate the age of the individual. In terms of adult, there are few methods, and then you can see in the adult compared to the children, the adult, normally sometimes the range of the age estimation is quite big. Okay, I think this afternoon we only concentrate on how to determine or how to do the age estimation on children, because in adult and sub-adult we need another session to do the what we call that, some sort like that, a course to do this age estimation for adult and sub-adult. Okay, dental age estimation in children. Okay, normally we look into 16 years and below. Okay, the method that we use more towards the tooth eruption and also tooth development. Last time we use more on tooth eruption. That means we estimate the age in terms of look into what actually tooth have already erupt, and we can determine. That is the simplest method actually, but it's quite subjective, and then that's why this afternoon I will explain into more like an objective method how to determine the age. Okay, we can see like I explained earlier that in children we can see that the tooth is still still in the stage of development. We can see that there are a few like molars and premolars is still underdeveloped. So we can use these changes of this development to estimate the age. Okay. So in this afternoon, I will only touch into 3 methods that I usually use, and a lot of us is usually use. I was asked by my supervisor why you use this method. Normally, we will use this method because 1 is commonly used, and then 2 is easier to it depends the how accurate that this method, and then after that I think this 3 method is normally widely used, especially in Europe. Okay, in children we can use an atlas, okay, the Mizan and also a Williams. Atlas is the simplest method. It's just you have this chart. Okay, actually this chart you can actually download from the internet. Okay, they have some sort like a QR code, and then this QR code will link to the website of the Queen Mary University of London, and then you can download this atlas actually, and then you can also download the article how they develop this atlas of human teeth development and eruption. This actually is developed by Ankatan and et al. In 2009. So what you have to do is you just compare an OPG, okay, into the stage where it match with this age. Actually, when you see that the age of 15.5 actually is the mid age, the median age. Okay, so by comparing this image, then you can compare with this chart and you can estimate the age of the individual. Okay, this I think this is the simplest method that you can use. Okay, provided all the teeth is there, and then you can see the development and the eruption of the teeth that is there. Okay, another method is the Mizan method, which the Mizan method normally is a classical method. Is developed in 1973. Okay, actually the Mizan used the self-weight score for dental stages, and then they use a staging into A until H, depending on the development of the tooth germ until the development of the tooth. Okay, the individual tooth for molars, premolars, canine, and incisor. Then after that, this is the stage of description. I think before you want to use this method, you have to get used to these stages. Okay, what are the A, B, C, D, E until H means? Okay, from this description, you can give a score to each individual teeth that you want to assess. All right, and don't worry, I will give you a step-by-step how to use this method. Okay, and then in this method, okay, actually he developed two tables which you give a stage A until H. Then after that, you have to accumulate all the score, and then you have to compare with this conversion of the maturity score to a dental age. All right. Not to worry about this value and also this table. I will go into step by step. Okay. For example, in this you get this radiograph, and then normally we will do the assessment, give a scoring on the left side of the mandible. So we just highlight that one, and then you just compare this staging into the sample. So like this one is an E. Okay, I see an E because the root is just developed, and then is less than half of the root length. Okay, like this one is G. Okay, G is because there's still the root is still underdeveloped, and then the apex is not closed, and then E, F, G, and H. And then when you see that H is fully developed, that means the apex closed. Then after you give all this scoring, then you will sum up all the scoring according to the staging. Then we will get the score. Okay, the value of the H, G, F, H, and so forth, you can get from this self-weight score for dental staging. There are the value. Let's say for molar 2, M2, okay, E is to 12.5. I got this value 12.5 is from here. It's molar 2 and then 12.5. Okay, and then so on with the molar 1, premolar, second premolar, first premolar until incisor. Then you will give all this scoring according to the stage. All right. Then after that, after you accumulate, you get the score. From the score, you just match with the age. Okay, like this one is 87.3. We don't have 87.3. We go to the nearest one. So the age of this individual is about 9.6 years old. All right. This is for the boys. You can see that there are different tables, boys and also a girls. Okay. And for this one, for the girls, the same, there is a score, and then you just go to the table, and then you just match like 88.8. This is 88.7. Then you will get the age of 9.3 years old. This is the dimension method, whereby you can use this method to estimate the age by using a score. All right. Not to worry. After this, I have about 6 cases which we will discuss, and then I go through one by one. All right. Okay. In Williams' method, actually, this is the not a continuation, but is the improvement of the dimensions method, whereby actually this method is developed by our Professor Guy Williams from the Catholic University of Leuven in 2001. Actually, they use a Belgium children sample. They have about 2,523 OPGs and equally distributed boys and girls. And actually, they use the Mizan 8 development stages according to the Mizan in 1973. And then from this method, they come out with these models, and also come out with the new table, whereby they only use one table, whereby this table, when you accumulate the value, it will get the predicted age or the estimate age for the individual. Okay, the staging is the same, but we use a different table. Okay. Okay, this is a picture of Professor Guy Williams. Actually, Professor Guy Williams is an orthodontist. Actually, he's the one who did. I think he's the founder of the course of forensic odontology in Catholic University in Leuven. And then beside me is my supervisor, Professor Patrick Davidson. This is a picture during my graduation in 2017. Okay, this is my colleague, my classmate, Dr. Sai. She's from India. Okay, for Williams method, you can see that they have only one table, one for the boys and one for the girls. All right, and then the staging method is the same as the method staging method by the Mizan, and then the only difference is that the table actually has already converted into the age. All right. For example, the same sample, the same individual, we do the staging according to the Mizan. Okay, like this one: E, G, E, F, F, G, and H. Then after that, we just use the value that is in the table. Then we can straight away it will converted into the age of the individual. This is more actually in both method, the Mizan and also the Williams method. The most important thing is that is to do the scoring. That's why sometimes we have to do some sort of like a calibration between our colleagues in order to standardize the scoring, and then we can do that accurately. Okay. And then we can see that the value when you do it properly, the age estimation, the age estimation is not that far. All right. So okay, we go one by one. I have 6 cases. Okay, I think for this slide, actually I used this slide when we had an age estimation workshop with the Ames University, I think last year. And then I used the same method and also the same slide. Okay, actually in this section we have 6 cases whereby we will look into 5 OPGs and then 1 full mouth PA, because sometimes we get a skeletonized skeletal remain. Sometimes you cannot take an OPG, then we have to take a full PA, full mouth PA for that skeletonized in order for us to do the staging and do the age estimation for the skeletonized human remain. Okay. And then most of the cases are children and then below 16 years old. I will use 3 methods, which is Atlas, Mizan, and Williams. And then there are the references. Not to worry, I will share all the references with the MAPD. Then you can download or you can, I think the committee will distribute, or you can ask from the MAPD to get all the references that I have. Okay. So case 1, okay, normally we will see is an OPG. When we see this OPG, we can then determine that this is a children. Okay. And then now we want to determine we want to estimate the age of this individual. All right. Then we go to the simplest method, which is the Atlas method, whereby we compare this section with this Atlas. Then you can see, you can look into each individual tooth, and then you can match into this Atlas. And then you can see that this belong to about 7.5 years of age. You can see that This is the crown. That's the crown of the 7 is still formed, and then the 6 is already erupted, and then the canine first and second premolar is not erupted, and then they're still in development stage, less than half of the root. Okay, same goes to the upper. All right, this belong to this age group, 7.5 years of age. Okay, then we go for the Demasion method. Okay, for the Demasion method, we look into the segment on the left side. Then we will give a scoring for this using this Demasion scoring staging technique. Then we will give each score to each individual molar, second molar, molar, second premolar, and first premolar. You can see in this section, there are some abnormalities on this development tooth. You are allowed to use on the right side to score the staging. Okay, for instance, okay, this one we give D. D is that shows that the crown is fully developed. All right, and then there is some sort of initial root development, and then for this one I put a G. When I look back, okay, I think this is not a G. Most probably is in the F. Okay, because normally if G, the root the root has already fully formed, the root length, and then but the apex is still open. But in this case, I think is in H, it's not G, because the root is not fully formed, not fully formed, and then I think it's more than 2/3 of the root has already developed, but it's not a full length of the root. And then for this one is an E. Okay, there is a initial root formation, but it's less than half. Same to this one, but in this one, in this area, sometimes because of the image is not that good, there is some imposition of the bone and all that, and then maybe there is some abnormalities on this tooth. We can use the other side of the radiograph to do the staging. All right, so for this one we put an F, and also a G. All right, because this G is because that this incisor is not, the apex is not closed. Then after that we give a score according to the tables that has been given, and you can get the sum of the score. From the sum of the score, you will go to the another table, which is a conversion of the maturity score to the dental age. This is for the boys. Okay, then we just match the value to the age. All right, and then same goes to the girls. The value is 77, the score is 77.2. Then you just go to the 77, and also you can get the age. This is lebih kurang macam during our school days, we have to use a logbook to find some sort that dia punya value lah. Yeah, this is the table how we use this table. All right. Okay, for the Williams method, okay, same case. So we will do the staging. Actually, the staging is similar as the one that kita guna for the Mizan. All right, and then we use the same the other side because of the radiograph. There is some abnormalities which we cannot do the scoring on that particular tooth. Then we can do the scoring, and then after that we just compare the table, boys and girls. We just compare the staging. Then we just add up all the value for all the 7 teeth until molar. Then straight away we will get the age. All right, we can get the straight away we can get the age, estimate age of the individual. All right, so this is the comparison between all the methods. Okay, So for the age estimation is better for you to use not only one, it's better to use more than one methods to confirm your range of the age estimation for that individual. All right. You can it's not advisable only use one method which you like to use Al-Qatani atlas, you just use that method. It's advisable to use more than one. Better if you have 4 or 5 methods you can use, you can compare. Okay, you can compare the estimate age within all the method that you use. All right. So case 2, same procedures. You just compare on the right side, and then the tooth development on this atlas. Then you can see that there is a 9.5 years actually is a mid age je lah. Yeah. So why I put 9.5, you can see that this one dengan this one, okay, is in between this range of 8.5 to 9.5. Why I choose about 9.5, you can see that in this area, okay, on the 7, you can see that there is a formation of the furcation, okay, furcation of the root. So you have to look into individual tooth, and then the eruption and also the development, and compare to this chart. Okay. Then same goes to the measure. You go for the staging. Okay. Then you just put a score into all these individual, all the seven individual teeth. Then after that you give a score. Then after you give a score, then you can see, you get the score, then you compare with this table, then you will get an age and the boys and also a girls. And then for the Williams, okay, same staging method using a dimension. Okay, then you just add up all the value, and it straight away will convert into an estimate age for this individual. All right. Okay, this is the comparison between the boys and the girls, and the age between a few methods that we use. Okay. Normally for the age estimation, we not determine, okay, this is this individual is 10.3 years old. No, normally we will give a range. Okay, give a range, maybe 9 to 10 or 9 to 11 years old, this individual in the report. Okay. Okay, in case 3, okay, same step. We just compare on the right, and then compare to the atlas. Okay, and for the measure, also you can you do the same step, whereby you have to do the staging of all individual teeth from second molar until the incisor, and then you will see that when there is some discrepancy in the radiograph, you can go to the right side to do the scoring. Okay. Okay, you accumulate all these the score, then you go to the table, and then you will get the estimate age for the individual, for the girls, and also for the boys. Okay, and Williams, same goes to staging method, same as the Mizan method, same. Okay, then you just add up all the value and then compare with the table, and then we will get the age of this individual. And then this at class case 4, also the same. Okay, and then in this case, you can see that there is some abnormalities on this. Maybe it's a retained deciduous, or they have congenitally missing of the 4. Then you also can use this the other side of the radiograph to do the scoring, or the state scoring for this for this 4. Okay, and then Same procedure whereby you accumulate all the values from the table and then you just compare and then you get the estimate age. All right. So I go through for the Williams, also the same, and then you can convert into the age. All right. Another case, okay. So I think, let's say, okay, in this case, you can see sometimes you cannot, that's why we use a few methods, because sometimes when you you look into this case, all right, you can see that there is some sort like contradicting, because you can see that all the what we call that the permanent teeth has already erupted. Okay, if we do this one, we can see that the canine, I think the canine or the premolar, the second premolar is not erupted, but this one is already erupted. And then you can see that the second molar, the development is already about half of the root. This is just 1/3 of the root. And then the stage is when you look into the individual development of the 7, you can see that this stage is at the 9.5. Okay, there is some methods whereby you are in the dilemma, because few different tooth that in a different age group. Okay, that's why I told you you have to use a different method to do the age estimation, because one method sometimes cannot be used in certain cases. So they might be 11 to 12.5 years old, this individual. Okay, and then we have to use this method, another method is dimension, and then we will do the scoring. And you can see even the 5 is already erupted, but the apex is not closed yet. So you give all the scoring to this individual tooth, and then you get the score, and then this is the estimate age between 13 to 3 years old, compared to the Atlas is between 11 to 12.5 years old. All right. And then same goes to Williams. Okay. Then for the Williams method is between 12 years old. All right, for girls and boys. Okay. So this is case 6. This is the last case. Okay. Actually, this is the actual case. Actually, case ni is an op wawasan where they find a mass grave in Wang Klian. And then one of the skeletonized, what we call skeletonized human remain. Then we have to do the profiling, and then we have to do full mouth PA. And then we can see that this must be a young individual, because we can see that from the full mouth PA, the 8 is still underdeveloped. And then we can see that the 7, okay, the 7 is not, the apex is not fully closed, fully closed. It's an open apex. So we also use the method using the Atlas method, and the individual we estimate that it's between 14.5 to 15.5 years old. And then when we do using the dimension method, okay, giving all the scoring, and then the individual we estimate about 15.7 years old and 14.6 years old. And then same goes to the Williams. The age is between 14 to 15 years old. All right. So this individual actually is in between sub-adult and children, is between 16, 17, 15. Okay. So in this borderline cases, we have to use, because there is third molar is still underdeveloped, and then we have to use another method for the sub-adult, which is use the mathematical method. is this study is from Gans and Mosseton, 2002. Actually, they study on 2,513 OPGs, and then there is all the inclusion criteria, whereby at the end of the study, actually they develop some sort like a mathematical models to predict to do the age estimation using one or more molars. Okay, actually they use Kohler et al. 1994 stage scoring 1 to 10, depending on the development of the impacted age. All right, and impacted age, not impacted, the development of the age. All right. From the crown, half crown until the apex close. Okay, AC is apex close. Okay, this one is apex half, and then is okay, root complete. Okay, R1, RI is a root initial, and R1 quarter is a quarter of the root length. Okay. Then this is the models. This is the mathematical models that you just put the score according to the tooth that you put the score, and then you have to use this value, and then it will generate the age estimation, what we call that, the age. Okay, the estimate age. Okay, they also there are different models for male and also female. From this study, they conclude that when you score 4 of the molars, third molars score 10, there is 96.3 in male the probability that individual is older than 18 years old. Okay, okay. And then for ladies, for female, is about 95.1%. If all the gigi molar, third molar, score 10, there are 95.1% probability that the individual are more than 18 years old. Okay. For this case, okay, you have to use, you can use this method, okay, to estimate the age of the individual. Okay. We use the Kohler scoring technique, whereby we just use the formula and then put in the score, and it will calculate the age. For this male, if this individual are male, the age is about 16 years old, and then for the female, they have another models. Then they estimate that age is about 17.23 years old. Okay, I think that's all for case 6. Okay, sometimes, okay, this is the comparison between all the age estimation, what we call that, age estimation method that we use. All right. Sometimes we cannot rely on dental age estimation alone. If you have another method, we can use even on the different part of the body. In Leuven, I was taught to use not only the age estimation using the dental age estimation, we also taught to use this evaluation of hand wrist radiograph. Actually, it's an atlas by Gruls and Pyle, 1950. Actually, it's an atlas. They have an atlas of the hand wrist from the children until I think the individual up to 20 years old, and then they have a male and female, and you just compare the hand wrist, and then you have to see the formation of the osteophyte on this wrist. Okay. And then another method, they look into the ossified clavicle bone, okay, through the chest X-ray. Okay. Then from that, you can estimate that individual using a different type of age estimation. So I think that's all my presentation for this afternoon. Okay. if you have any question or any doubt, anything that you need information about age estimation, you can email me through this email address. Okay. So I think that's all from me. Thank you very much for your attention.
Thank you, Colonel Dr. Wan Azmil. Actually, there are several questions in the chat box.
Oh.
From Dr. Kenneth Liu. Good
Okay.
afternoon, doctor. Is it possible we only take PA on lower third molar to do the age estimation due to the limitation of the X-ray film?
Yes, I think.
Yeah, I'll probably will go one question in one. Just probably you can answer that first.
Okay. That means we use only the 8. I think you can use 8. Yeah. Because you can see that because I'm not going further on the, I think further on this method. Normally when you find out that there are impacted 8, there are impacted 8. Sekejap there are impacted not impacted 8. There are 8, okay? There are 8, okay? Kalau ada gigi third molar, I think you can use this formula, okay? This formula. I think kalau Dr. Yusmi ada, I think Dr. Yusmi actually in his PhD punya project, PhD thesis, actually he has a so-called a formula actually for the Malaysian population. I think you can use Dr. Yusmi's method also. You can use the age estimation using the third molar. In this formula, okay, if kalau ada 4 third molar, and then you can see that dia punya standard deviation dia is more orang kata accurate lah compared to what we call that kalau you use only one gigi, alright? So you can use third molar, but you have to go into a different method lah. One of the method is this method by Gans and Mortensen. All right. I think in this method, I think we need to have another session actually for this one. Okay. There are a few methods actually you can use, but since I think I am more prone to this because this study is in Catholic University in Leuven. We there in Belgium we use a lot of this method, especially for third molar, if the third molar is available. All right.
Okay. The other questions also by Dr. Liu. Is the chart, can the chart be used for Malaysian? And then probably you can see from the chat. Can the chart only can be used for Malaysian? And can the atlas, the Mizan and Wheeler method used for all patients or only below 16 years old? And how about if patient lose one tooth in left mandibular region?
Okay.
Can you see the
chat box?
Chat, yeah.
Mana? Okay.
Okay. Can the chart be used?
Can be used for Malaysian. Actually, it can be used because that is just for the references. Unless kalau misalnya if we have our own study in Malaysia, okay. If I'm not mistaken, I think Dr. Fadli, the Dean of USM, and also Dr. Prof. Nick Noria, actually have done using the Williams method. Okay, they come up with their own chart for the Malaysian, but I think the differences is not that much lah. That is the one. I think it can be used. Okay, even right now in KU Leuven they are comparing between all different countries, and then they want to see if there any vast difference between each country dengan the study, the data that they have. Okay, if we have our own data, okay, and then we have our own family, our own what we call our own chart, then is more accurate in our. But for me, I think in my personal opinion, we can use this method as a guide, okay, as to do the estimate on that particular individual. All right. Maybe there is some different, but we only, because we don't actually, the age estimation is not to determine that a individual is 8 years old, definitely 8 years old. No, actually we look into a range that this skeletonized or this individual is either is in children or in adult, sub-adult or in adult. And then for the children, at the range of which what age, okay, between 2 to 4 or 3 to 4 is more on range, okay. And then another question is Williams normally we will use under 16 years old. Yes, okay. Kalau lebih pada 16 years old, all the tooth has been developed, all the stages are all age, then you will get only 16 years old, okay. If there is a third molar, then you have to use the Guns and Mortensen's method to determine the age, because the age is more than 16 years old and less than 23 years old. And then if there are patient with one tooth left on the left, you can use the other side, the right region, okay. Let's say kalau if this one, you have to remember that they use the sample, the normal individual yang tak ada any pathologic change for the data, okay. This is for the normal punya person lah, okay. If kalau you on the left hilang, then you can use on the right side, okay.
Dr. Azmil, there's another question. Is from Dr. Sophia Hazim. Is the request for the age estimation comes from the law enforcement agency? Are dental officers allowed to produce the report without referring to the specialist or forensic specialist?
Yang ini
that's an interesting question.
This one I tak berani nak jawab, because I think that one I think we have to refer to Dr. Yati lah, our forensic odontologist in KKM. For that one, yeah. For that one, I think you can do the age estimation, yes, but I think you have to ask from Dr. Yati lah, yeah. About this.
True. I would advise also to get an input from the forensic odontologist. Maybe Dr. Yati is Dr. Nohayati, the forensic odontologist in KKM, the one Dr. Azmil is talking about. Because you must remember the report that you make has legal implications, and it's not a one-off thing, and you might need to be called to court to defend your report and those kind of things. So it's better to get forensic specialist input lah. Yeah.
And then I can add up another thing is that sometimes the age estimation ni sometimes you cannot do individually. Normally kadang-kadang kalau you ada ramai colleagues, then you do the calibration, and then after that do the staging is even better lah. Yeah. For a group effort lah, itulah. But like Dr. Joanna said that is ada legal implication. Is better for you to get input or consult from forensic odontology, because now in KKM we have 3, Dr. Nuraliza, I think more than 3, Dr. Nuraliza, Dr. Adha and Dr. Yati, and then if I'm not mistaken ada seorang ataupun 2 orang lagi yang baru balik from Dundee. Okay.
Okay, if there are no further question, I would like to thank Dr. Wan Azmil for the presentation. Also, thank you for the examples, because then we can see the clinical application lah. Actually, us in Shah Alam also has a case pending in terms of age estimation in the case of adoption. Dr. Wan Azmil has kindly shared with me his PDF format of the lecture, minus some irrelevant slides. So we will share, MAPD will share with the participants the PDF lectures as well as his references when we email you the certificate of attendance. So please ensure that you fill up the certificate of attendance link. All right, for everyone's info, next webinar in May will be, now it's everything X of something, pediatric dentistry X pediatric endocrinology. Things to look for in patients by Dr. Rashdan, a pediatric endocrine from Hospital Raja Perempuan Zainab II, Kota Baru. So please make sure you follow the Facebook social media, the social media of MEPD to get the late information on the next webinar. So I thank everyone again for joining us this afternoon, and I thank Dr. Wan Azmil for your time and effort on this presentation. So thank you everyone. See you next month.